Hi class, this is Dr. G again for part 2. We left off where I was just getting ready to start talking about ATI tutorials. ATI is a program that we have purchased, or well you have purchased, but we have adopted to help with being successful for the NCLEX. So students who use this NCLEX prep tool are very successful on the NCLEX, and hence why we have such a high percentage of students passing NCLEX. I'm not sure what the exact last percentage is of the last time, but I know the last one I heard we were at 100%, so I'm not quite sure this winter if we are at 100% yet or not. Anyway, so it's a great program. It'll help you study. So we've got these ATI set throughout your skills lab as well as your theory, and a few for clinical. This is just, again, to help you be successful. So what we do is we have you set up and you do a lot of systems and tutorials and modules and things like that throughout, which will help you be prepared for any of your nursing classes anyway. So you'll have these throughout. You'll have one in Pharm, which you've probably been introduced and saw. You'll have it in your obviously your skills lab and fundamentals, but your med-surg classes, psych, pediatrics, maternity, etc. They're your main core courses. But anyway, so for this course, what we're looking for is for you to achieve in your, when you take your exam, you're going to do an ATI proctored exam, and we're going to want you to at least try for a level 2. Level 3 would be fabulous, but at least try for a level 2. If you get a level 1 or below level 1, then you're going to have to retake the proctored exam, and I really hope you don't have to do that. So I'll do my best to help you, but you also have to read the material. So I have in the templates, and we'll go over, or not the templates, the topical calendar. We're going to go through that, and that will that'll tell you what chapters to read. Sorry. Oh my goodness, I couldn't think where I was going. Anyway, they're going to, the topical calendar for ATI is in, and I'll point it out to you again in the topical calendar when we go over it, about the reading assignments for each week with it. So it better prepares you for the proctored exam, because you don't want to read 100 to 200 to maybe even 500 pages before you take the proctored exam. So again, that's what that's all about. If you don't do so well, like we're hoping, because things get in the way and all that stuff, so if you do receive a level 1 or below level 1 for this ATI proctored, you'll have to retake it and do more remediation templates, and these remediation templates all have to be handwritten, and so they're really a pain, but yet they help better prepare you, so when you do have to retake this proctored exam, you'll be better prepared for it anyway. So it's another way of helping you be successful. In this course, we also have a life review project, and you have a part 1, part 2, and a part 3. Part 1 is just your actual visit with a older adult that's over 70 years of age and not related to you. Usually you can find these patients not patients, but people in your churches, your neighbors that you do know, not some strange neighbors, or maybe some of your friends, or you guys can swap parents or grandparents or something like that to help meet this criteria. Last semester we had a guy that had a bunch of people in church that was willing to help many of the students. So think about that, because it is kind of a challenge, so keep that in the back of your mind as we work throughout this course of making sure you have that visit completed on, and we'll go over that on the topical calendar as well. And then finally, you're going to summarize part 2 is the written paper, and you'll need to make sure you hit all the components from the rubric on this written paper so you get full maximum points. And then finally, the third part is to send a thank you card to your participant that helped you with your project, because they really like those thank you cards, and they do take about an hour to 2 hours out of their busy schedule to help you with your assignment. So it's just a nice thing to do for them. And I'll let you read these, because I'm not going to read all these assignments, and we'll go over it in class anyway. The fun part with clinical, you're actually in the hospital taking care of patients. You need to make sure you read this and follow the policies. There's a lot of things that come up in here that is very important that you need to follow. For example, the big one is no medications will be given without your clinical instructor present in the room with you. We've had students try to do that and they end up making medication errors and then they get kicked out of the program. Again, we don't want that. We want you to be successful, and we're going to do everything we can. And the main thing about that medications is make sure your instructor is always, always with you. All right. You'll also have clinical prep starting March 2nd. That is where you'll come to clinical the night before for 1 hour, and you're going to fill out your paperwork for clinical the night before so you can get to know your patient, their pathophysiology, the medications they're on, any labs, just a little bit of history and physical about the patient so that you know about them before, because that's going to start when you're working the 12-hour shifts, and you really need to know the ins and outs of your patient when you're there for 12 hours. Those 12 hours will go pretty quickly for you. Also, you need to follow your hospital policy regarding cell phones. Even we have you purchase Nursing Central, some agencies still will not allow you to use cell phones, and you have to use their computer program to find medications and things like that. So make sure you follow your agency policy before just getting on the phone. Clinical dress code, I'm not going to tell you, it's your responsibility, so make sure you read the dress code, what you need to wear for clinical prep as well as for in clinical. Make sure you follow the absentee policy and tardiness, because that can lead to bad things down the road, so we don't want that to happen to you. So make sure. We do know emergencies happen and things like that, so you may have to miss a clinical. We have clinical makeup. It's based on the hours that you've missed. So if you missed 1 hour, you'll do a clinical makeup, but our clinical sims, and they're in simulations, are 2 hours long. So you'll have to, if you miss 1 hour, you'll have to make up for 2 hours. And so it's in 2-hour increments for that makeup. So try your best not to miss clinical, because these are done April 30th and May 2nd after your finals. And when you're done with your finals, you want to be done with the course. All right? So you don't want to hang around and have to do 6-hour, 8-hour clinical makeup. All right? Let's see. What else do I want to? You can read all this information here. And I think that's about it for this. And then we'll begin the topical calendar. Let me go back up to the top here where the topical calendar is. Oh my, it's way, oh, there it is. Okay, so you can just click right onto that topical calendar, and it's going to give you your link. I need to add the clinical topical calendar. It just dawned on me, so I still need to add that. That's down in the clinical area, and you'll see the bold letters, clinical topical calendar. So I'll have that ready for you guys too when by the time you open this and read this, I hope. So that'll be my job tomorrow. Okay, so what we have here is the topical calendar for just the theory component. And as you can see, here's that ATI reading that I was talking about in the pink color. So you'll have these, you notice, through most of your reading assignments. That will help you prepare for that ATI proctored. You will have a quiz 1. That is to help you be successful in lab, and those are based on what you're going to cover in lab for that day. But we also cover that lecture part in lecture, and so that's why we take 20 minutes out of the lecture part to take the quiz. And this way you have the full 3 to 6 hours to complete your lab assignment. We also have, like I mentioned, the weekly Elsevier adaptive quizzing. So those are there for you. Follow this topical calendar closely for your assignments of when they're due. This will help keep you organized for this course. Also, I'm going to be discussing, you have a process recording in theory. So I'm going to be discussing that with you on February 9th on how to do that, because it's due, I believe, the following week in clinical. And then we're going to discuss a little bit more in detail about that life review project so that everybody's on the same page on how to complete that assignment. Your first exam, you'll notice it says group exams. So your exam 1 and exam 2 are group exams. They usually shouldn't take more than 75 minutes. That's why I put the time there, but if it goes over, that's okay. I'm not lecturing after, but I just don't want you to take the full 3 hours to complete a 50-question multiple choice exam. So it should be okay. Everybody should come prepared, and you can't just write the answers down because you may not agree with that person, and you can always write your own answers. But it's just a way of learning from each other about your thoughts about these questions. And then you'll have the main Elsevier adaptive questions with all the chapters ahead of time that are due this day. Module 6, you want to prepare for a 5-minute teaching activity. Just keep that in the back of your mind. That is where you're teaching your partner in class. You're not presenting to the class, so don't worry about that. But it's just teaching each other something related to health, or I've had students teach origami and motorcycle safety lessons, things like that. So just it's your best bet what is easiest for you to teach, and then we're going to talk about that for part of the lecture. We also have these ATIs in here where you need to plan accordingly, because it's due, this first one here is due on March 1st, but they're locked so that you have to retake it. Excuse me, if you don't get it 85% on the first time or higher, you have to retake it, and it's locked where you have to retake it every 24 hours. You can only take it. So it's a little bit more challenging, so plan accordingly to try to be done before, plan ahead of time before the due date. And that's how all these ATIs for this course is set up. Exam 2 is on March 22nd. You will have spring break on March 29th. And then when you come back from spring break, that April 5th is the ATI proctored exam, and then I'm going to lecture after that about fluid and electrolyte. So we're going to be in room 255. It's the computer room there in the NSE, and we will stay in there all day, so that way we can get that completed. No need to change rooms. And then finally, you will have your final exam, and this is an individual exam. It's a cumulative, so it's for the whole semester. Hopefully you'll learn from each other on how to take the final exam, or answer those questions, because some of them are going to be very similar. They won't be exact, but some of them are going to be very similar to what you've seen on exam 1 and exam 2. And so this is individual. It's going to be on the computer. We're going to be in room 255 again for this. You don't have to worry about bringing your laptops or anything like that. We will use the computer in there. Exam 1 and exam 2 are paper written, so you don't have to worry about laptops on those. It's just only on the final exam we're going to go on the computer, and that's the only one that is computer driven. Your quizzes, however, are computer, so please bring your laptops with you, or any device again that you can take your quizzes on. I can't remember if I mentioned that, but I'm going to mention it again, so please make sure you have those with you on our quiz days. We might have a few extras somewhere in the building, and I'll make sure we have a few, but I don't think we have 30 laptops to spare. So, and that should be it. So that's your review for the course. If you have any questions before the start, please send me an email. I'll be happy to answer. It's just that we have so much to cover in the first 2 weeks that I didn't have time to do the course review, and so I just want to make sure we get started on lectures. So please send me an email before day 1, and I'll do my best to answer all those questions if you have any. All right? Thanks, and we'll see you next Tuesday.